the precious earth where we live, and the islands of Japan. Blue sky, green of trees, clean air and water are essential for all living things. However, its environment has been contaminated along with industrial development, causing various pollution problems with a tremendous impact on human health. At the same time, we have gained wisdom to control them and reflect it on our behavior. We have been establishing rules to protect the environment in which we live. Against the mounting awareness of pollutions, the Pollution-Related Health Damage Compensation and Prevention Association was founded in 1974 as a special public corporation under the jurisdiction of the Environment Agency and Ministry of International Trade and Industry. This video outlines the activities of the association through images.
A healthy and affluent life. That is what everyone aspires to. Nevertheless, we have experienced a number of pollutants which threaten our lives. We have already overcome some of them, though there remain areas which need improvement. It is not an exaggeration to say that the Pollution-Related Health Damage Compensation and Prevention Association has grown along with this history of pollution. As its name shows, there are two pillars of this: compensation for individuals concerned about having suffered health problems due to pollution, and prevention of the occurrence of such suffering. First of all, let's have a brief look at the social background in which the association was founded.
From the mid-50s to mid-70s, with the rapid development of the economy, smoke and effluents discharged from factories contaminated the environment and began to affect the health of area residents. The industrial paradise of Japan is filled with pollution. Pollution posed the greatest problem in the 1970s. Then, suffering caused by pollution was widespread, reflecting the government's attitude of only carrying out surveys without taking any practical measures. Pollution-related diseases, such as Minamata disease and Yokkaichi asthma, posed a great social problem at the time, and those who suffered these diseases have aggressively sought compensation by resorting to lawsuits. The decisions known as the Four Major Pollutions Judgments were handed down from 1971 to 1973. To deal with the situation, from the middle of the 1960s to the middle of the 1970s, the government laid down laws which make up the backbone of today's pollution countermeasures. One of those laws, the unparalleled, epoch-making Pollution-Related Health Damage Compensation Law, was enacted to promptly relieve persons suffering from health problems related to pollution. The establishment of the association was also specified in this law.
We owe our health and productive life to the surge of public awareness of pollutants and the efforts of factories and workplaces. Also, to the pollution prevention measures and arrangements taken by the national and local governments and compensation systems. Let us now touch upon one pillar of the association's activities, the pollution-related health damage compensation system.
This system compensates those who are deemed to have suffered by pollution in areas where air and water are remarkably contaminated, imposing the burdens on polluters. There are two groups of areas compensated: Class 1 areas and Class 2 areas. Class 1 areas are designated as areas where a number of respiratory diseases, such as bronchial asthma and pulmonary emphysema, occur. Class 2 areas are specified as areas in which diseases that have an apparent connection with the pollutants, which cause diseases such as Minamata disease and Itai disease, occur. The patients who have been diagnosed as suffering from pollution-related diseases in those areas are given certification and can see doctors free of charge and are given compensation.
The association is responsible for collecting the fees necessary for compensation from pollutant-emitting factories. These fees, together with grants from the national government, are paid to local governments. Certified patients are offered the fees for their expenses by local governments.
Local governments conduct recognition screening of, as well as registration and administration work for certified patients. Furthermore, local governments provide respiratory training to help patients recover their health. As to Class 1 areas, 80% of the necessary expenses are collected from the factories discharging sulfur oxides, the typical air pollutant, and the remaining 20% are appropriated from part of the automobile weight tax. The highest number of patients compensated exceeded 100,000 at the program's peak, with the total amount of compensation exceeding 100 billion yen. The amount of compensation was tremendous. Regarding Class 2 areas, the factories responsible for discharging pollutants are supposed to shoulder all expenses.
The association administers the pollution-related health damage compensation system and acts as an intermediary between certified patients, corporations, and the government.
41 cities, wards, and towns nationwide were designated as Class 1 areas. However, in general, air pollution has been improving, and in March 1988, all designations were canceled according to the amendment of the law. Since then, the recognition of new patients has been discontinued, though those already certified have continued to receive compensation. At the same time, the association launched activities that focused on the prevention of the occurrence of diseases such as bronchial asthma by targeting local residents. That is another pillar of the association's activities, pollution-related health damage prevention program. In order to pursue health damage prevention activities, we collect money for a fund from factories which discharge air pollutants, automobile manufacturers, and the government, appropriating the working profits and interest for operational budgets.
Now we'll describe in detail how health damage prevention activities are operated.
There are two categories of health damage prevention activities: those conducted by the association and those carried out by local governments with the association's subsidies. The fields of asthma prevention and health recovery, as well as improving the atmospheric environment, are covered comprehensively by the association and local governments. In the past, the main air pollutants were discharged from factories, like sulfur oxides. However, the main pollutants have changed to nitrogen oxides and particles emitted by automobiles. Prevention activities have been arranged in this situation.
Let's take a look at the association's activities. Take this bus, for example. This seemingly normal bus is equipped with a device to purify the black smoke contained in its emission gases.
To research and ensure that automobile traffic's impact on the atmosphere is as little as possible, the association has been involved in the development of devices to make low-pollution automobiles, such as electric cars, and the development of technology to purify contaminated air near roads. Besides, we have also been studying the methods to prevent the occurrence and symptoms of asthma, and to help asthma patients recover their health.
The association also has the important job of conveying information about the prevention of asthma and recovery of health, and of promoting an environment-friendly way of life.
With these purposes, we produce various kinds of brochures and animated movies to be utilized by local governments at places of related activities.
プールにはそのダニカビホコリがないから喘息の子供には安全な運動場ってわけだ。それからプールには湿りっ気があるから発作を起こしにくいし、何より良いのは泳ぐ時に息をいっぱい吸って吐き出す時の呼吸の仕方が、ほらのりこちゃんも毎日やってる喘息体操の腹式呼吸と同じなんだよ。
Annual events, such as the Low Emission Vehicles Show, the Asthmatic Children's Swimming Festival, and the Air Pollution Prevention Campaign, have been held as part of these knowledge dissemination activities. The Association and the Environment Agency co-sponsor these events, which have many participants every year, and have steadily taken root in local areas. December is Air Pollution Prevention Promotion Month. On television, we forecast air pollution conditions caused by nitrogen dioxide and call on the public to limit their use of cars.
Among the activities conducted directly by the association is training staff of local governing bodies associated with the health damage prevention work so that they acquire the latest knowledge and technology. Next, let's take a look at the works subsidized by the association which are promoted by local governing bodies.
As to subsidized activities, there are three spheres we place special emphasis on among the health damage prevention programs: health consultation, health examination, and respiratory training. First, the health consultation work, related to respiratory diseases such as asthma, provides medical specialists advice to anyone, regardless of whether they are patients or not. This program has been well received. Second, through health examination work. If an infant is found at a checkup to have a high possibility of developing asthma, health instruction is provided at that time, and then at subsequent checkups. Currently, more than 60,000 people see doctors each year. Third, respiratory training is comprised of swimming and camping, which are considered to be effective for the health recovery of asthmatic children, with approximately 30,000 children participating every year. Low-pollution vehicles, such as electric cars and natural gas automobiles, are extremely effective for improving the atmosphere in cities. Therefore, the association shoulders part of these expenses when local governments and private enterprises purchase and promote these cars. In addition, the association is involved in tree planting to purify the polluted air. This is part of the work done by local governments, subsidized by the association.
In the past quarter century, pollution conditions in Japan have dramatically improved. On the other hand, pollution caused by nitrogen dioxide and particles is not improved upon easily, especially in big cities. Today's environmental problems are posing the question, how should we, as individuals, live?
In order to maintain healthy and rich lives, we must remain diligent in our efforts. We, as individuals, as well as administrative organizations such as the national government, local governments, and private companies, are called upon to do our part. The many works of the Pollution-Related Health Damage Compensation and Prevention Association are not only relevant to the comfort of our everyday lives, but are paramount to the future of the human race.